The National Health Insurance Plan is seen as a critical requirement to improve quality and access to healthcare services in the Virgin Islands, but it is also to safeguard the economic stability of the territory. This point was raised by Territorial at-Large Representative Archibald Christian during his contribution to the debate on the Social Security Amendment Act 2013 in the House of Assembly on Tuesday, April 8th.
At Peebles Hospital in the general ward, you pay $25 a day, which includes accommodations, doctor, nurses, etc. In a semi-private, it's $40 for the same services. In a private, it's $50 for the same services. And Madam Speaker, if I go over to a number of other countries and hospitals, but I'll just go to the closest one, Anguilla, it's $275 a day. US dollars. A semi-private is $375 and a private is $425. If you go down to Jackson Memorial, it's $1,321 a day for a semi-private. For a private, it's $1,593. In Bermuda, it's $1,348. And for a private is $1,607. In the Turks and Caicos Islands, OTI territory, it's $825 for a semi-private. It's $1,200 for a private. Madam Speaker, the current structure that we have today is not sustainable anymore. If we don't fix all rates and fix the national health insurance and incorporate the national health insurance, we're going to bankrupt this country under the current system that we have.
The BVI has a population of over 30,000 residents. 47% of the population suffer from chronic diseases, and almost 65% of the population do not have health insurance and cannot afford healthcare costs. 82% of the BVI Health Services Authority clients are exempt from paying for health care. Most of the remaining 18% cannot afford to pay for the services they receive. The cost is observed by the government of the Virgin Islands. BVI Health Services Authority delivers about $550,000 worth of services monthly, but only collects about $150,000 monthly for those services. Meanwhile, Premier and Minister of Finance Dr. Deolanda Smith said universal health care would enable residents to live longer and healthier lives. He said the plan, developed with assistance from a team of researchers from the University of the West Indies, found that the cost of health care in the BVI is around $50 million annually. Dr. Smith says the UB team offered a system that would provide health care to all citizens at a similar cost.
I was interested, Madam Speaker. We invited the University of the West Indies to send this team with Professor Theodore, and we put together a team of local people, doctors and nurses, and people from Social Security, and they got together and started to divide this plan. But the first thing I told them, Madam Speaker, is that you got to demonstrate to me that it's affordable. That was the first thing. And they came back and told me, Madam Speaker, that the national cost of health care in the BVI was around about $50 billion per year. And having done the statistics, they believed that they could provide this service within that framework. And so I was comfortable that we at least were on the right track. Madam Speaker, I am glad to be here today to see the finalization of the project. In those days I think when we started, I was a driver behind the project. and I was happy to know that the previous government took up the challenge. But I'm glad that we now finally brought it here, Madam Speaker.